the first question I'm going to ask you is, what is your job title and what are your primary job responsibilities?
Okay, so okay. I am a doctor of physical therapy. My job title, well, I do home health services, and then I also PRN in skilled nursing facility.
Mm-hmm.
So my responsibility is to evaluate the patient, build a plan of care, supervise the physical therapist assistant. I will go over ordering any supplies like splints. Most of the time you have to make sure that your assistant are doing modalities correctly. Doing any reassessment or discharges. I communicate with the doctor regarding orders, and I have to make sure my paperwork is done in a proper manner. That's it.
Okay. So, then following, so what is like a typical day in the life of work for you?
Well, for me, home health services for my company, so I wake up, I do any pending documentation. Then the night before, I call my patients to see what time can I come, tell them what time I'll be there. Then I show up, I do the evaluation, treatment, reassessment, or discharge. Once I do all that, I come home, I try to call my doctors, and then I finish my paperwork with home health.
Okay. So, obviously some days are more busier than others, right?
Oh yes, it depends on how many patients I see within that day.
Okay, and usually how many patients do you typically see within a day?
I would see from anywhere from 4 to 6 patients, but I drive between exit 55 and exit 2.
Oh, okay.
So a lot of my time is spent driving. So.
Okay. So yeah, I guess in your field of work, what are some of the most common injuries you see, and what are some preventative measures that people can do to prevent them from happening?
For me, since I work in inpatient, so you will see a lot of stroke patients, a lot of falls which result in hips. I see a lot of knees after a total knee replacement. For me, you know, the geriatric population, those are common. So you're going to see them. For fall prevention, you want to make sure it's proper lighting in the home, proper footwear. You want to make sure proper supervision. I think the biggest thing is once my patients get to a certain age, a lot of family members don't realize that they should not be at home alone.
Yes.
And they're at home alone. Some of them fall and lay on the floor for days just because family members are not aware that either their cognition is changing or their functional mobility is changing.
Okay. So like even with like, I guess whenever a patient breaks a hip or has a total knee replacement, like for most of those injuries, which is like the hardest to recover from?
It just depends on the patient. So it depends on the patient's age, any comorbidities they have going on. Every patient is different, so you really can't say, but the more mobile they were before, the better the outcome.
Okay. So besides being in a home health services, now, what are some other areas of physical therapy which you have chosen and why?
Well, I like pretty much all of the areas. So I like outpatient, but I really like aquatic therapy was one of my passions in school. I love home health. I love skilled nursing. But for me right now, I wish I could do a little more aquatic therapy.
Okay. And so I guess for aquatic therapy, like what would a regimen, what kind of regimen would you set up?
Well, it just depends on my goal for them.
Yeah.
So what I see a lot is my patient with osteoarthritis that have a hard time walking, or my very obese patient, because the water takes off some of the load on their joints. I really wish we had more in the area.
Yes. Okay. And so since obviously you are a physical therapist, and I hopefully want to become a physical therapist, can you explain like the physical therapy school application process?
Well, the application process is pretty simple. You have to send in transcripts. You have to fill out, I think it's been a while for the application. I remember the school process, your GPA, kind of making sure you have your observation hours. I recommend that you get observation hours in all settings. I think it looks better if you do. Recommendation letters is the big one. Make sure you get good recommendation letters. And I think those are the most important pieces of the application process. I also recommend early admission.
Okay. So like obviously for someone who's undergrad, like what are the best ways to build up their resume?
For building up your resume, I feel like it will come more with the observation hours. Making sure you have experience in pediatrics. Even if you don't want to do it, I still say get observation hours in those areas because it looks good that you're well-rounded. Also making sure you have extracurricular activity on top of the academic piece because it shows you're a well-rounded individual.
Okay. And so like while someone even is an undergrad or even in physical therapy school, what are your best networking tips?
So for me, my networking tips kind of came from, once again, my observation hours. And even my recommendation letter came from my observation hours as well, because it's important to get to know the place you're working at, making sure you ask questions. My PT mentor came from my observation hours as well. So those are and also getting to know other physical therapists and physical therapist students. It's very important.
And so like, I guess how important is it to like make connections, or like did you have any difficulties making connections within the physical therapy realm?
I don't feel like it was difficult, only because at the time they had the pre-rehab, so you had the organization where most people want to go be a physical therapist, so you got to know other individual. Also, getting to know your professors. They have meetings. When it was in Savannah, PTAG meetings, PT club, those where you would kind of get a lot of networking. But I feel like networking is very important. Excuse me. It's all about who you know sometimes.
Okay. Yes, that's what I'm trying to figure out, trying to connect with people. So, like as you mentioned before about observation hours, how would a student, an undergrad, or even a high school student interested in physical therapy, how would they go about obtaining these observation hours?
All you have to do is call a facility like a PT clinic. You call a PT clinic and say, hey, I'm interested in physical therapy, just some observation hours, and then they'll let you know if they allow students to come in, and then they'll tell you when to come in. I always recommend that you bring a sheet so you can have your hours and they can sign off on them as well. I also feel like when you go on your observation hours, it's very important to ask questions and be involved.
Okay. So, I'm trying to think. So like what happens how should like a student trying to become a physical therapist, how should they handle like rejection of not obtaining observation hours? Because I know sometimes some students are met with resistance and like they can't do it, or like the offices don't call them back. So like what is your advice for handling that?
I say if they don't call you back, I personally would go to the office and see, hey, I'm interested in coming here for some observation hours. Do you allow students to come in? So I feel like, if you don't get them on the phone, because sometimes a lot of people don't answer the phone these days, at least go up to the place and say, hey, I'm interested. Or once you get to know other physical therapists or physical therapist student, you can kind of get some recommendations on some places to do observation hours.
Okay. Next question. So, I guess, for the final question, what would you say is your favorite part about being a physical therapist, and like what is some of the best advice you have been given as a physical therapist?
The best part of being a physical therapist is you can't change everyone, but when you at least get that one patient that shows major change based on what you have taught them. So for you to have a patient who has not walked in years or in several months, to see them be able to walk and be able to do the things that they would like to do. And so the best advice I was given is, as a physical therapist, you're not going to know everything. You're not going to know how to do everything. But you know, you go in, you assess, you treat the symptoms, and then you go do research. Continuing education is very important because medicine changes every day, every year. So I always know that you will learn from someone else. You don't know everything.
Okay. And then like even in healthcare, so like obviously there's some improvements that can be made. So like for you personally, what were some improvements that you think could be made?
One of the issues with physical therapy, and I think a lot of physical therapists have, is the productivity standards can be very strict. And because of the productivity standards, you can't always give the patient what they may need at that time. Like if they need a lot of one-on-one attention, or you know, you have to see multiple people at a time, it's hard to give your all into one patient at a time. And then hard to meet the productivity standards as well.
Yeah, just trying to be productive and all that.
Well, yeah, if you know, some places are a little more lax. If some of those standards change, I feel like we would be better off.
Okay. Well, all right. Well, thank you, Miss Amber, for sitting down and being interviewed. I greatly appreciate you taking the time out your day.
Oh, anytime. You know, anytime you need me, just text me, call me.
Oh, thank you.
You're welcome.